for joining us this afternoon. We've got a special guest. Patrick Phillips will be calling in. He's actually on the road this afternoon. He's had an appointment out of state, and he's actually driving in and wanted to join us on our webinar today. So it's going to be great to have him. If you're looking at the second screen here, this is just a quick overview of today's webinar. I wanted to kind of just give you a quick snapshot of the 8 reasons we will be discussing doctors need you for medical billing. Now, as you'll see here, we're going to be talking about these, and it's actually going to be talking in like which you would see in person, and we're talking to the doctors. So this is developing for a marketing piece that Patrick and I are working on, and he'll explain a little bit more about that today. Again, my name is Eric Auger. I'm the Director of Research and Development here at American Business Systems. As I mentioned to you earlier, we got a special guest who is going to be joining us remotely here in just a moment. Patrick Phillips. He is the founder and the Chief Executive Officer here at American Business Systems. Full day, the Apple computer plant was still here in the Dallas. He was formerly working with them here. He's on the editorial board at Billing and Coding Advantage magazine. He's also the chairman of Medical Revenue Managers Associations of America and best-selling author. He's authored several books. And if you're looking at the screen, one of the ones that are just recently been that's coming out is the New Thriving Medical Practice. Folks, now this you can see there, that is co-authored with Dr. Vicki Wagner, and Dr. Wagner works with us here at American Business Systems and helps us as we're so a lot of this information that we're going to have today on the webinar is coming from Dr. Wagner and other places as well. So without any further ado, let me get Patrick on here. And Patrick, if you're there live driving back, I hope you're still there.
Yes, Eric, can you hear me okay?
I can now.
So 8 reasons why doctors need you for their medical billing. Now, folks, we know that doctors, a lot of them, can do their own billing, right? They have their own staff. They have their own software. They've spent thousands of dollars probably training people, updating their software, getting the right hardware, setting up networks, etc. And so a lot of doctors have decided to maintain that within their own offices. We're going to show you today why doctors should not be doing that.
One of the things I wanted, there's a news of some of the from the very beginning of the year, some of these that some people may have seen once before, but the one that we're looking at right now is a report that was done by the HIT group, which is the Healthcare Technology Group here. And this is on their website that reports that 66% of the providers are going to focus on improving their RCM in 2016. Frank, you want to talk about what RCM means real quickly, and then we'll get into this number?
Right. That's just an acronym for Revenue Cycle Management. In other words, doctors think of their whole use as all they collect from insurance companies, from Medicare, from Medicaid, and, of course, from their patients. So the revenue cycle and the management of that is very important to a doctor because, well, obviously, they see all these patients that don't get paid. Well, that's not good for anybody, right? So, but look at this, Eric. This was amazing for me to see this because 66% of all providers are focusing on that in this year. And that's because I think it's becoming very critical to the doctors to stay in private practice. That's why me and Dr. Wagner have written our new book, The New Thriving Medical Practice. A lot of doctors are not thriving in private practice, and so they need all the help. Why we need more people, a lot of the folks that are on the call today, getting involved in this business because there's a huge need out there, as you guys will see as we go through all these different reasons here. I love this next quote also, Eric, the 42%.
Yeah.
All physician practices that have, 1 to 5 doctors in the practice, those are the smaller practices that are out there, of course, with employed billing in the next 12 months. So there shows to people, Eric, that we do have a huge market that's unfulfilled out there.
But basically what Patrick is saying is that, first of all, there are other medical billing companies that are out there. They're not able to service everybody. Some of those outsourced billing companies that some of the doctors are trying to get away from. And so one of the things that we'll hopefully be able to share with you today is what makes ABS and gives us here at ABS the advantage over other medical billing companies and also medical billing companies that have been around a lot longer than you have, because some of you are just wanting to get started just now. So we'll talk about that. But I thought I'd bring this back out here because you're always talking about, as anybody's looking at getting into any type of a business, you always want to make sure that there's a market for it. And then we're looking at this one right here where I got the arrow pointed to that, healthcare in and of itself is a $2.1 billion industry in and of itself.
Yeah, so for all the different industries that are illustrated here in this chart, you'll notice the largest one is the big black circle there in the very middle that the arrow is pointing to there, health. And folks, health is a huge industry, and that's why if you're getting any, you should, is on a growth pattern, not shrinking.
Right. So, I mean, you can see the other ones, real estate and food and beverage, but healthcare is just a huge chunk of that. Again, I brought this back up here because these are going to be and I've kind of just really, as folks, as you'll see here, we've really drilled these down just to some simplicities here. 8 reasons why doctors need to outsource their medical billing. Patrick, I got this first one up here, and I knew that you'd like it because you and everybody else here at ABS is pretty big Apple fans here. So number 1 is the focus on core activities.
Yeah, I love this quote from Steve. By the way, you mentioned, Rick, that I did work for Apple Computer back in the early 80s when Steve Jobs, in fact, Wozniak was still involved in the company as well, the 2 Steves, they're called, and I got to meet them there at the Dallas plant where we were actually building the first Macintosh computers. But this quote boils it down, folks, as to what this number 1 point is. That doctors should be focusing on their core activities. Like Steve says, deciding what not to do is as important as deciding what to do. Well, this is something managing their payments and their billing that doctors should not be doing.
Right. So, we're pulling this information together and we're building a here. Pat, one of the things, because you wanted to say something about the way that this is being read, is actually addressing directly to doctors. And this is something, again, that you and Dr. Rackner have been working on. So some of these 8 core things here that we're going to be talking about here, it seems like we're talking directly to doctors. But why don't you take this first one here, what it means to focus on their core activities.
Yeah, so here's what we mean by that. Now, imagine, folks, as you're watching this today, imagine us having a tool that we're developing for you to use in presenting to the doctor these things, all right? So we've worded it because we are at the top. So billing services will allow refocusing on those business activities that are important without sacrificing quality or service in the back office. Now, that will appeal to doctors because they know they should be focusing their staff on helping them see more patients and helping those patients get through the process of going through the office. The more patients they can see, the more money they make, and that's their core competency. That's what they were trained to do. They were not trained to do medical billing.
Right, and a lot of the folks that actually work in the office have been trained as well in the medical billing, and we find many of our licensees that when they get into a doctor's office and they really start asking that office manager or the other folks that are in the office, we find many of the people that actually quote-unquote handle medical billing have never been to billing school or coding school or anything.
No, in fact, they probably learned, from the person before them. In other words, it was on-the-job training. And so we tell people, and this is true, folks, you'll find out when you go to our week-long training here in Dallas, it's a hands-on, intensive workshop. And when you get through it this week, more than 99% of all office managers and billing experts that are out there in doctors' offices about this industry. We cover that much material in that 40-hour week.
That's exactly correct. Now, moving on to number 2, another one of the reasons that the doctors need to outsource for medical billing is the cost and efficiency savings. Now, Patrick, it's a great quote from, again, Benjamin Franklin. He says, "Beware of little expenses, as small leaks will sink a great ship." And I think, Patrick, and I bet you a lot of folks that are on the call today imagine that if a doctor has staff billing. That's probably saving them money. Why don't you, as we go to this next part, really the cost factors of actually having someone in their office doing the billing?
Yeah, you just touched on it right then, Eric. It's true that most doctors, if you ask them, hey, what do you think it costs you and your staff to process a claim, an insurance claim, in your office? The doctor will probably say, oh, I don't know, $1 or $2. You know, maybe some of them would even be bold enough to say, oh, I don't know, $3 or $4, maybe $5 a claim. Because when you think about what little time it does take to process a claim, it seems like it shouldn't cost them that much. But Eric, we have statistics show people who've done these studies for doctors to show that it costs way more than $20 per claim to process that claim.
Yeah, we actually, in past webinars, I know that we've had some other doctors that have actually done their own research, and it does. It costs the doctor sometimes, like you said, up to $20. And if on a $100 claim, well, that's, I went to public school a long time ago, but math tells me that would be 20% of what they're trying to get back there. So when doctors think, well, I can do my billing for 2 or 3%, that a heck of a lot more than that.
Well, and as people will learn when they go through our training, of course, that's a big question a lot of people have. Well, how do I charge the doctor? You're charging the doctor a percentage of the money actually collected. Now, there's the difference between the staff in the doctor's office. They don't get paid any more, whether they collect more or less for the doctor, right? But you will be intimately tied in with that revenue cycle by getting a percentage of every dollar that's collected inside that office. So for most private practices, Eric, it's just impossible for them to keep up with all the numerous requirements and regulations.
Exactly. And part of all the support that gets here with ABS, let me just briefly talk about that. A lot of people ask, well, you know, what's the investment and what do I get for the investment? Folks, what you get for the investment is the support back end. And what Patrick just said is, we here at ABS, we don't sell any other type of business opportunity. All we do is sell and talk and train on medical billing. That's all we do 24 hours a day for 20 plus years. So we do know the industry, and we do know the regulations and the things that do transpire during while someone's doing medical billing. So part of what you're getting here is that support, which the doctors need. So it helps them on their costs and the efficiencies of their the savings of what's going on there.
Okay, so we teach people to go through called practice analysis. That helps them to gather the information from the doctor or their staff on exactly what actual costs are inside the office. And we present back to the doctor a proposal that shows them, bottom line is that we can either save him money or we can't. And of course, in 9 out of 10 cases, we can. So it's a wonderful way to, help wrap up a deal with the doctor.
All right, for number 3, one of the other reasons, and again, Patrick, I know that a lot of people are going to not know what ICD-10 is. You want to explain that before we go any further than this number 3? Okay, let's see if he's still there. This is the fun part. Folks, this is live as you can be. Let's see. All right, so I don't know if we've lost him or not, but I'll explain to you real quickly. The ICD-10 is nothing more than the diagnosis code is what would be wrong with you as the patient. So, in fact, as we're looking at it right here, there is a new version. We switched from ICD-9 back in October of 2015 to now we're in ICD-10, and there have been some of the most unusual codes out there, and obviously what you're looking at here on the screen, it asks the question: have you suffered a burn due to your flaming water skis? Your doctor will soon have a code for that. So as you can see that, folks, these codes are huge. They're mapped. The nice things about ABS and the system that we have is that our system actually does the coding, correct coding, the correct diagnosis coding for the doctors through our electronic medical record system. If had an opportunity, for those that are on the call today, if you haven't had an opportunity to see that in action, get with your ABS coach, and we'll certainly be able to help you out with that. But you can see here that number 3, the rise of the diagnosis codes from 13,000 to 68,000 was anticipated, and is going to increase the of cycle time. So we're talking about either doctors not getting paid or expanding the amount of time that they'll actually get paid. Patrick, are we back with you here?
Yeah.
Okay. Okay, perfect. So we were just talking about the ICD-10s here, and even though that, Patrick, I know that you and I hit this pretty hard last year, 2015, because that gave an opportunity window for brand new licensees to get involved with this. But there's actually another window coming October of 2016, considering the diagnosis.
Yeah, and that's when we call it a window of opportunity, folks. Between now and October 1st, it's a great window of opportunity for you to go out and present to the doctor the fact that they are going to have to be really, really accurate on their codes, or they don't get paid on them.
Correct. Yep, that's just what it gets down to. So, again, here at American Business Systems, we're keeping up with this. Our systems keep up with it. You'll never have to worry about, do you have the latest updated codes in your system for billing. All right, Patrick, I know that we're...
So, Eric...
Yeah, go right ahead.
Eric, let me just address that coding just for a second, because
Sure.
a fear that a lot of people have that are looking into this business is that they have to know about the codes. And maybe you said this when I was off the line there just a second ago, but it's just so important that you folks realize that you don't have to be a coder. In fact, the doctor is the one who's required to give you the codes. And believe me, if they've been being paid at all by insurance companies, they have been giving you, they have been using codes. Now, they may not be the best codes that can maximize their revenue, but that's what our system does for you. They actually suggest to the doctor the codes that will maximize his revenue.
That's correct. Yep. We did go through that when you were off there just for a second, but thanks for repeating that and making that confirmation there. All right, Patrick, we're at number 4 here. We're at risk management. And I know that a lot of people in the corporate world know about risk management, but from one of your favorite guys, Warren Buffett, he says risk comes from not knowing what you're doing. And I think we find that a lot of times with doctors too as well. And as it pertains to risk management, in which you see continuity here with the doctors, doctors do have, sometimes you'll find a high turnover. Oh, Patrick, yeah, hold on, Patrick. I think you're going in and out there, so I'm not really sure if you're hearing me as well. But folks, again, as you can see here, that the doctors do end up having a high employee turnover. A lot of uncertainty, a lot of inconsistency with operational flow. And outsourcing will help provide a level of continuity to the company while, again, reducing the above-mentioned risk within the company. You'll find, just notice the doctors when you go to see the doctors. You'll notice that you got new people there. Sometimes the doctors keep their again, it's down to the people that actually do the managing of the revenue. Sometimes some people you don't see, but at least with an outsourcing company, pretty standard that those people are in it for the long haul here. And so that's what we're talking about here. And these are some of the things that we will be talking to the doctors and creating these marketing pieces directly for you. When it comes to work, it says hurry, 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 but whenever it comes to payments, delay, delay, delay.
Well, that's the way most people are, when they are paying any kind of bill, especially medical bills, put it at the bottom of the stack at least. But folks, that's why we have services that allow you to help the doctor collect even that part. An outsourced billing services will ensure that you are transmitting claims electronically to all possible carriers and are set up to receive ERAs, further reducing turnaround time. Eric, you want to talk about ERAs?
Yeah, ERAs is the electronic form of basically what the company is paying the doctor. And again, within our system, a lot of not only are you sending out payments electronically, but you're also getting back from those insurance carriers what they've actually paid the doctor, again, electronically. And it allows you to post that, keep up with what's going on in that specific area for that doctor, basically how much they got paid. Because again, at the end of the month, you're going to take that report of everything that the doctor got paid, which again is on average is right around $55,000 a month, in which you're going to be charging that doctor roughly about 6%, which is going to do $3,500 a month based upon those numbers. And so how do you get that number? Well, it's through these ERAs, this electronic posting of exactly what the doctor got reimbursed. That's what their promptness, faster payments for the doctors. And again, talking about that, Patrick, we're seeing some of our doctors get paid within less than, almost I'd even say this, less than 5 days of them seeing their patients. That's how fast we're getting doctors paid with our specific billing system.
There are lessees who send in a claim on Monday, and the money is in the bank account of the doctor on Friday. They cannot believe some of them 45 to 60 to sometimes up to 90 days before they see the money. So this is very important to a doctor. It's called cash flow, and it's very important in a practice to make sure that he meets payroll and that he's able to purchase new equipment and so forth. So our system just. Well, part of it, Eric, has to do with the built-in clearinghouse. I know that's not a part of this point here, but folks, if you've heard about clearinghouses, they're usually a third party that you send the claims through to make sure that they're scrubbed clean and reformatted. We do that all internally in our system, and that gets the money much, much faster back to the doctor.
Absolutely. Accountability and control. Now, we're talking about the control for that specific doctor. And again, we found this other quote today of talking about control yourself or someone else will control you. And a lot of times, Patrick, I know a lot of people get into this that, they want to go own a business, but sometimes a lot of the businesses end up owning them. And that's what we see with doctors. They lose a lot of control.
Well, that's why some doctors have decided to keep the billing in-house. They don't want to lose control. They want to stay on top of where their money is. And most billing companies do not have a cloud-based system or doctor kind of data. I mean, bar charts and pie charts and all kinds of things in real time showing the doctor where his money is. That's important to a doctor.
Of course, exactly. And that's, again, when the doctors know that they can get that at any time, especially online, 24 hours a day, 7 days a week. It's better than it's almost them having someone in their office keeping up with that as well. We're getting down to 7 and 8 here, but I know that we're going to have a little bit more information here. But when we're talking about less stress and more cash, worrying is stupid. It's like walking around with an umbrella waiting for it to rain. That's
I know people like that.
I know. I see a lot of doctors like that too. But let's talk about less stress and more cash.
Yeah, see, for a doctor, folks, this is the one thing that keeps him up at night because he doesn't feel in control. His current billing staff or outsourcing company does not give him the information that he needs to know where his money is. I mean, he gets checks in, right? Every week there are checks coming from the insurance companies, but that doesn't mean it's 100% as getting 70 or 80% of the money that's due him rightfully because he's already done the work, but because of incompetency, bad systems, he's not getting paid what he should. And our system can eliminate that. Eric, as you know, we can get the revenue for a doctor up to 98% of all the money that's billed. And that's, it's unheard of. Most of them are, losing 30, 35% of the money.
Then lastly, trained specialists. And again, we kind of already mentioned that earlier, that, even within doctors' offices, not all people that are in there that are wearing the scrubs have actually gone to anything that has any type of training. Expertise is the mantra of modern medicine is what we've got here is this particular quote. But whenever getting a trained specialist, especially here with ABS, is going to help out. Patrick, I mentioned earlier about what you are, and you sit on the board of the Certified Medical Revenue Managers. Why don't you talk about that and what people actually get here from ABS as being a Certified Medical Revenue Manager?
Expertise in any field today is important. People want to do business with experts. So how do you become an expert in 1 week with our training? Well, first of all, we're not going to teach you everything about it. We're honest enough and upfront enough about that to tell you that all we can do is give you the basics of what it takes to get business started and get your first client. Your education will continue with our weekly webinars that we do for our licensees at no cost. Every single month we do several of these webinars. So folks, you are going to become the expert in time that is the person that can be that trained specialist that the doctor is looking for. And that is our certification, folks, which is very unique in the industry because there's no other industry out there that has a network, an organization like we do. Folks, here's one of the things you can do to position yourself, for example, as the expert in your area. We'll train you to say exactly these words. I've just opened a local office in this area. I'm a part of the nation's largest network of medical revenue managers, and we collect millions of dollars in uncollectible revenue for those doctors. See, doesn't that position you as being much more than somebody who just took a course at college on how to do medical billing and then downloaded some software and works out of their spare bedroom?
Yeah, that's correct. Exactly. Patrick, as we've got 20 more minutes here, and we've got a little bit more here. Those were the 8 that we're actually working on for our licensees to help them as they market their business, and some of the things that they'll be able to use, and some of the information that's based out of your new book that you've got with Dr. Ratner. But we wanted to kind of go in a little bit deeper here. There's some hidden benefits of medical billing services that we want to kind of tap into, and maybe for the next 10, 15 minutes or so, we're going to try to just kind of go through these, and then we'll obviously be able to take some more questions here at the end. But look at this first one. We want to talk about helping the doctors achieve a positive ROI. What we're talking about here is to help the doctors, again, achieve a positive return on their investment is critical not only to the doctors, but again, also with any business, as we can see here. Here's the statistics showing that 79% of practice administrators, again, are looking to cut ties with billing vendors that are not producing a return on investment in 2016. Now, these are actually updated information for us here at American Business Systems, helping understand. So as we're thinking about this, we're looking at several things. Is there, first of all, a market for this business? Obviously, you can see that the statistics that we've given you already show a huge percentage of doctors looking to switch out, doctors that are looking to outsource for the first time, and then also looking at maybe getting rid of some of their vendors that are not producing. So again, get with your ABS rep, whether it's me or anybody else. We'll be happy to show you a demonstration of how we can achieve that positive ROI for the doctors. Patrick, did I hear that you talk back in here?
Yeah.
Okay,
yeah,
perfect.
Maybe it wasn't such a good idea, me calling in from on the road. But it sure shows it's live.
Okay, we're talking about now in this one about the decreased practice overhead, about 14% gross revenue of physicians divert as much as 14% of their gross revenue to ensure accurate patient service. About this one too as well, Patrick?
Yeah, think about it this way. If the doctor is spending, let's say, $100 would be $14. So $14 out of every $100 that the doctor is bringing into his revenue each month. That's a tremendous amount of money that the doctor is spending just to make sure that his billing is accurate. He does not have to be spending half that with you as the outsourced medical biller, the expert that he turns that over to. And yet for you, it could mean thousands of dollars in revenue from that doctor for very little time investment.
Exactly. And then talking about practice efficiency, and then we've kind of talked about this already, but we wanted to give you these true statistics of where we're pulling this information from. And here you can see nurses and medical assistants spend 20.6 hours per physician per week on administrative tasks related to health plans. Man, if we had the time for the rest of the afternoon just to talk about how much time it takes for the doctor's office to review patients' insurances, just to make sure that the patient that's coming in with the insurance today, that they're still valid with that insurance. Thousands of dollars are lost because these people who are nurses and medical assistants are trying just to chase down to see whether a patient has insurance or not. And again, within in our electronic health record system, I think I was telling this to someone today, that within our system allows a real-time opportunity for the doctors not to have to worry, the nurses not to worry, or the system to worry as to whether the patients that they've got coming in today have valid insurances. The system will actually give real-time feedback as to whether someone's insurances that's coming to see the doctor today is valid or not. So that's really important on that. Complete transparency. One of the things that we mentioned earlier, again, within our system, Patrick mentioned about complete transparency. And what happens with our system, the doctors themselves actually get a login to our system to allow them to see what is in their days of accounts receivables. There's so many doctors that don't even know what's going on with our accounts receivables, what's actually owed to them in a 20, 40, 60, maybe even 90, or even higher than that, over 120 days in arrears, what's actually owed to them. Our system allows complete transparency of that as well. And then again, we're talking about the ICD-10 transition. A lot of doctors are still struggling with that, and it's obviously whenever the doctors keep coming, when we get closer to the October date of this year, October 2016, as we get closer to that, the company along with Medicare are going to get more tight on, are the doctors using specific codes, not unspecified codes, but more specific ICD-10 codes. Right now, they're a little leniency right now, but again, currently, our system is already making sure that they're more specific than not. And the last couple of things that I want to share with you here is the reimbursement to quality care. And again, here, all of this is, again, showing is that 35% of practices have already begun to transition to what's called a value-based care, and growth, and the growth continues tremendous. The expectations over 75% of practices will have some form of value-based care contract in place by 2017. So again, we're talking about small to medium-sized practices that are trying to achieve these value-based goals here. This is what you're looking forward to over the next year, even going into next year. And again, there's some of the things that we're already a part of. Now, a lot of people ask about the Affordable Care Act. I think we all know it, again, as Obamacare. And again, the Affordable Care Act added so many new rules and regulations, just medical. But folks, it goes even further than that. Let me just briefly, again, talk to you about the Affordable Care Act. But all that means is that patients are their own responsible parties to make sure that those insurances are paid and paid on time. It's not like an employer where you're working for someone and you are pretty much depending upon your employer to make those monthly payments. Unlike that, the patients themselves are responsible to make those monthly payments. And again, what happens is that the doctor, they may see the doctor 1 month and they've made their payments. If they stop making payments, that person is no longer on with that particular insurance company. But they still have the card, and they'll use that and show that to the doctors. Again, after the billing process gets going, the doctor ends up finding that the patient wasn't really covered. And it's just, I've had many doctors ask me about that. Well, will your system let me know if someone's on the ACA program and they're no longer with that particular insurance company? We definitely are able to do that. And again, lastly, the whole part about medical billing is doctors don't have to worry about negotiating with the payers or credentialing or anything. We've got all that covered. That's part of what we do already. So again, folks, these are some of the reasons that we're helping you. We kind of let you in on a little of what we actually teach in our training class and some of the marketing material that you actually get here as an ABS licensee. And these these are some of the 8 reasons, even more than the reasons that we've gone here today, when we're dealing with you and your potential doctor, because we are part of your marketing. You'll find out that we will be directly directly to your potential doctor, and again, we're here to help you out all along the way. I don't know if we still have Patrick here. I don't know if we lost him completely. Thought I'd give him
I've just been kind of listening and hoping that I got a better signal, but I'm still
okay. Well, Patrick, as we kind of get wrapped up here, we've got about 9 more minutes here. But I didn't hear you come pop back in here. But why don't you kind of put a wrap here on everything that we've said so far, and some of the things that we're working on already here at American Business Systems, some of the things that we're helping our licensees do currently.
This is the perfect time in this industry for you to get involved in helping doctors with this vital part of their practice. Look, doctors have always been, they know that they're not the best business people in the world. You'll find that out when you start dealing with them. And everybody who deals with doctors agree. They will tell you that doctors are not good business people. They know that. And so for you to be able to step in and help those doctors thrive in their practice by making sure their cash flow is what it needs to be, it's very rewarding in more ways than once. From an emotional standpoint, you're helping the doctors, which helps the people in the community. But of course, for you and your family, you're building a business that's very solid, that'll be around for many, many years, as long as there's sick people, as long as those people have to go to the doctor, as long as the doctors have to bill somebody to get paid. And I think Eric probably has our guarantee there on the screen. But again, there it is in writing. You'll see that in the agreement. Ask your ABS coach that you've been dealing with here at the office to see the actual agreement that you'll sign with us, and you'll see that that guarantee is in writing there.
As Patrick mentioned, you come on by and visit with us. We'd like for you to do that. We'll even give you the opportunity to talk with other ABS licensees who have been right where you are. Patrick, just over the last couple of weeks, has went through 3 Wednesdays, 3 weeks in a row, interviewing folks who are ABS licensees who wanted to be interviewed by us. Remember, right where you are. And those folks are available for you to talk to, learn more about the industry, learn about the industry, about how they got their doctor, what's going on with their doctors, how they got their first doctor, and how, again, the help here of us helping out with that as well. And again, please check out our purchase agreement, and it does talk about the money back guarantee. Vicki is asking the question again about this. How much is the total cost of the license investment, the licensing fee investment, Patrick?
Our license fee is $24,990. We can round that up if you want to and just talk about it as a $25,000 investment. Now, include not only train here in Dallas and all the professional marketing materials that you need, but lifetime support. We support our licensees forever because we make some money on the back end of each one of the services. For example, all the claims that go to our clearinghouse, we receive a rebate from the clearinghouse on that. That's not money you pay to us or the doctor pays to us. Our technology partner pays that to us. So that allows us to be able to support you forever with no charge to you. Folks, we don't nickel and dime you. Yes, it's a lot of money, but if you compare it to a lot of other business opportunities out there, it's a very low investment for what you're getting.
And he was question about what are the franchise fees for American Business Systems?
Yeah, and again, folks, since we're not a true franchise, we're a business licensing arrangement. That just means that licensing fee of $25,000 is a one-time lifetime fee. There are no ongoing royalties or fees to us as a company. You never pay American Business Systems another dime, ever.
There you go.